Let me begin, though, by offering Dr. Charlie Simmons again my personal congratulations for an outstanding honor and one well-deserved and overdue. Congratulations, Dr. Simmons. I have probably the easiest task this afternoon as a facilitator for a phenomenal panel, and that I'm sure when this is complete and you have loads of questions that you will completely agree with me. But my task this afternoon is quite easy in terms of introducing the order of the presentation. The panelists will go forward in terms of making their presentation, and then I will actually pose one or two questions to them, and then we certainly want to again urge you to submit your questions, and if you have not submitted any yet, to please again reminder that you were just reminded to please put your question on the note card and somebody will collect it. I am not going to read bios in this wonderful age of technology. I understand that all the bios for our panelists are online and available to you. And so they've asked that we make sure we leave time for the discussion. And so in the order of the presentation this afternoon, as the order they're sitting in terms of Dr. Mindy Full-Love, who you will absolutely find phenomenal, as I do in terms of her work, Professor of Clinical Psychiatry at Columbia University, Dr. Lester Spence, Professor of Political Science and African Studies, Johns Hopkins, and Odette Ramos from Presidency of Strategic Management Consulting, and certainly last but not least at all, in terms of phenomenal Baltimore-owned Davon Love, Director of Research and Public Policy, leaders of a beautiful story, clearly Baltimore's own. And with that, I'm going to take my seat and turn it over to Dr. Phillip.
Hi, everybody. It's a really great honor to be on just such a prestigious and interesting, fabulous day. And I'm a psychiatrist, and so psychiatrists like to talk about the thing that we can't talk about. And we like to talk about the process of how do we get to the thing that's defended against, repressed, denied. And we believe that the truth shall set you free. And in this sense, what I want to propose is that we've been talking about the fact that we have answers, but we lack will. So what's between answers and will is the question that I want to tackle. So I've been studying epidemics in inner city neighborhoods for a long time. And one day I said to my daughter, it was like, you know Passover, when Moses went to the Pharaoh, and Pharaoh, he said, let my people go, and Pharaoh said no, and then God sent the plagues. What do you call that when there's a lot of plagues? And she said, oh, you call that mad plagues. So anybody who's been around the inner city over the past some years, like me, has seen mad plagues. AIDS, violence, the crack epidemic, the asthma epidemic, the mental illness related to crack epidemic, the mental illness related to violence epidemic, etc. It's just a huge series of plagues. And my quest was, where are these things coming from? And the answer that I came across was that they're coming from policies that break the city into parts defined by race and class. And these are not simply pieces that are all equitably divided, but a system of putting some on the top and some on the bottom, and the people at the bottom don't get much. The point is that when you do this to the city, you break its functioning and you injure the whole society. This is what we mean by mad plagues, and this is what I see as the problem. This is in a way the secret. On the other hand, in the course of my travels and going to see many people in many cities here and in other countries, I see people working at the cutting edge of this and really trying to say, okay, we can heal our cities. We can heal the cities so that everybody can have this equitable future, this good health that we've been talking about. We can do all of these wonderful things that are part of the urbanist agenda. The trick is that the downward spiral that we're in from mad plagues has to be shifted so that we can move into this upward spiral that the urbanists have identified for us. And so what I'd like to tackle is the pivot from self-centered fear, which is the system of hatred of the other that we are trapped in, to a kind of other-focused confidence. How could we come to love and trust each other the beloved community that Reverend Martin Luther King Jr. and others have described to us. I happened to spend a lot of time in Pittsburgh, and out of that, I came to know the story of urban renewal in Pittsburgh. Pittsburgh did 3 of the most horrific urban renewal projects in America, and all of these tore up the city, and it's been difficult for the city to put itself back together in the wake of that. In 2004, I came out with the book Root Shock, and part of what I did in this book was tell the story of urban renewal in one of Pittsburgh's neighborhoods. And I think it's fair to conclude that telling this story, which people knew, in my book, the story that they had told me, that reflecting their story back to them, helped people in the city of Pittsburgh to do a kind of truth and reconciliation, not as a formal program, but as a personal investigation, as a personal interrogation of how would they like to see their city move into the future. And I believe that my colleague Maricela Gomez's book, Race, Class, Power, and Organizing in East Baltimore, presents the same kind of a story, a difficult story, an important story, which can feed and nourish the process of truth and reconciliation here in Baltimore. I believe that this truth, putting the story, these difficult stories on the table, these stories of racism, these stories of allowing people to die for reasons that can barely be explained in our consciousness, when we look at these stories individually and collectively, we create something that allows us to pivot. I actually was wondering, what is it that allows us to pivot? And I am really, really grateful that I'm here today, because I believe that the congressman said it perfectly, which is that these stories cause us pain. They bring home to us the pain of our mistaken policies, of our hatred. They teach us what happens to people when we do these terrible things. From pain, he said, comes passion. From passion comes purpose, and from purpose comes policy. That's the pivot. The second thing you need once you pivot is a table. We had tables at lunch. I had a lovely conversation, in fact, with some young people who are here with Davon Love. Wonderful conversation at lunch. At a table, we need very large tables so that we can all sit together and have a new conversation about how we will make our cities not as sorted out cities in which the people at the top have a good life, supposedly, and the people at the bottom have a bad life, but where we're all rotting together, but a really cool city where we're having huge amounts of fun. In the course of my work and going to all these cities, I have identified the tools that once we've pivoted, once we're at the table, the tools that we'll find there to help us make the city. I called these the elements of urban restoration, and because I have a background in chemistry, I thought we needed a periodic table of the elements of urban restoration, which I therefore made. I was having a fight with my editor. She said, the numbers aren't in order. And I said, I thought it was a really preposterous conversation. I said, I made it up. She was like, no, they're not in order. So, this is like a unicorn. Where do you put the horn? We can have a huge amount of fun in the city if we stop sorting it out and defining life's chances by where you live. We are all in this together. And we are in a state of pain, but we can move from pain to passion to purpose to policy. Thank you.
Well, I'm seeing if I can get this to work right. By show of hands, how many of you actually have read or have Dr. Fully Love's book, Root Shock? Show of hands. So I know most of you guys have smartphones. For those of you with smartphones, iPhones, iPads, purchase it now. Her book is, to use academic language, really, really, really dope. Real talk. Okay, when I was asked to do this, and I was asked to do that, I decided to do this because a really good friend of mine asked me I think he's in the audience. Michael Scott, is Michael Scott here? Could you stand up for me? Michael Scott does incredible work with Equity Matters, and I really wouldn't be here if it weren't for him. So my presentation is not as information dense as Dr. Fullylove's, but I think it really it pushes against it in some really, really important ways. When I was asked to do this, we had this conversation, and Dr. Blum talked about how there's a lack of conversations about race and about racism. And I was like, you know what, we talk about it all the time, but what we don't have enough is actually political organizing. We don't have enough politics. So what I'm gonna do in the brief time I have is to talk about politics, and to not talk about it as much in a kind of a psychological sense, but talk about it in a material interest sense. And I'm going to talk about racial politics, and I'm going to talk about intra-racial politics. Baltimore is a predominantly black city, and although it's easy for us to get into a narrative where we pit non-white interests against white interests, what I want to do is complicate that and suggest that within racially subjugated populations, you also have diverse interests that play themselves out in problematic ways. So let's go. Politics. How are we going to define politics? So for the purpose of this conversation, we're going to define politics in one very simple way. Politics is the competition over scarce resources between groups. Now, when we're talking about scarce resources, what are we referring to? On one hand, we could think about those scarce resources as tax dollars, right? April 15th just came. I did not file my taxes. That's another story. But we could think about taxes and the way taxes is a zero-sum game. Money that's spent on a military base is not spent on social service provision, right? We think about limited resources or scarce resources as the vote. Even in Chicago, casting a vote for candidate A means you cannot cast a vote for candidate B, right? And finally, we've got my man Bill. I'm just a Bill. I'm only a Bill, sitting here on Capitol Hill. Like legislation, I'm not your dad's professor. Legislation, right? When you write up legislation, there are ways to write legislation that benefit some groups and take away benefits from others, almost by definition, right? But there's the thing. There's this other scarce resource, care. Now, I'm the parent of 5 children. When you're raising kids, you often tell your kids, oh, you should love everybody. Everybody you should love. When you actually try to put it in practice, you find it's pretty hard. You really can't love everybody. Right? Like I teach a gaggle of students. Some of them are like, I really care about the ones who are always there on time, always asking questions. Those students tend to get more care, delete this part from the video, than the students who don't, right? Care. Care is a scarce resource. Now, here's where Dr. Fullylove's panel presentation is really, really powerful and it really connects with mine. What I want to do is talk about wealth inequality. This is what the wealth inequality gap looks like from around 1920 to around the present moment. You see that it spikes around 1929, around the Great Depression, and it spikes now. But there's this U in the middle, right? What's the consequence? Why do we have that drop-off in the middle? It's the function of political organizing. In that period, you've got the New Deal. In that period, you've got the Great Society. In that period, you have the Civil Rights Movement, to a lesser extent, the Black Power movement. All those movements were connected to legislation that provided a safety net, that made it very, very difficult to discriminate against men, against women, against people who are handicapped, and provided us with a language to talk about a progressive form of government. But what causes it to rise, right? Why does it rise around 1970 or so? Around 1970 or so, you've got 2 dynamics that come together that theoretically aren't supposed to. High levels of inflation, high levels of unemployment, right? The model that when people are trying to figure this out, the economic model that they usually would use to figure stuff like this out revealed itself to be broken. So in the absence of that economic theory, something to more the society, you had the generation of what we refer as neoliberalism. That is a set of policies that drastically redistribute wealth upwards, right? It generates a great deal. So what are the consequences, health-wise? Bam. Wealth inequality tends to generate significant health inequalities or health inequities. There's significant differences in the level of stress, significant differences in heart ailment, significant difference in asthma, significant differences in gun violence between societies with high levels of inequality and low levels. Now, how does this happen? How does this happen? If we can see this, how exactly does this happen? Dr. Fully Love suggests it's fear. There is fear going on. But what happens is through politics, a set of images are lashed onto government. So this is the face of welfare, right? This is the face of crime. And then to sync with some of the stuff Odette's going to be talking about, we know what the face of immigration looks like, right? It tends to be Latino and it tends to be male. What happens is these images are lashed up to policies that have a set of consequences. They make us believe that government is in essence corrupt and that the best solutions we can wield, whether you're talking about health disparities or a range of other issues, is actually less government than more, with one exception, right? So we will routinely use government to punish people on welfare, to put more people in jail, and to be really aggressive and punitive on perceived undocumented immigrants, right? So that's a political process. It's a political process that's the function of us having different material interests. There's a racial dynamic to this. There's an intra-racial dynamic to this. So as Dr. Fully Love pointed out, there are in places like Baltimore and Detroit, where I'm from, there are sections of black populations that have resources and large swaths of black populations that don't have resources. What happens is that this section has a material interest in continuing these policies and actually serving as a broker between the masses of black people or non-whites and then whites. So how do we deal with this? I like that. Now, Baltimore's budget is approximately $1.6 billion. Baltimore's health department budget is approximately $150 million, so it's like 10%. Baltimore relatively recently gave $100 million in tax credit to just one entity in the Inner Harbor. So if we think about what our project is fighting for the public and fighting for ways to actually take resources at the micro level, at the city level, and take them from populations that have a lot of them and apply them to populations that have very little of them, I think that a policy like this and others like that can easily move us to the path where we're re-envisioning the public, where we're capturing the public, making a claim that government can and should work, and that should, over the time, not just give poor populations the ability to master political speech, not just give poor populations the ability to participate in government, but should increase security and safety for all of us. Thank you very much.
I'm a little short, so this podium is hiding me. Can I come out in front of the podium somehow?
Take the microphone.
Microphone? Okay. Yeah, I can just come this way. Thank you. Thank you. I'm sorry. I just couldn't be hidden behind the podium. Excuse me. Thank you. So I don't have a slide presentation, but I wanted to just bring a couple of points. First of all, my name is Odette Ramos. In addition to being the president of Strategic Management Consulting, I'm also the former president of the Baltimore Hispanic Chamber of Commerce, and also ran for city council in the 12th district in 2011, which was a really incredible, awesome, and difficult experience. And I hope to do it again soon. So, thank you. So, what I wanted to try to bring to this conversation is just describe a little bit what the Latino population in Baltimore looks like, and then talk about some of the difficulties that we've had. So, the Latino population in Baltimore, first of all, I'm Puerto Rican. My family's from Puerto Rico. We go there every Christmas, which means what? I'm an American citizen, always have been. And Puerto Ricans always have been since we became a territory of the U.S. The other part of so we have a significant amount of Puerto Ricans here in Baltimore. We also have people who've been in Baltimore for a very, very long time, so aren't just newly arrived. So we talk about the immigrant population who are coming in pretty much in droves, but that's not our entire population. We have people here, second and third generation, who are successful business owners, who've been successful business owners and very much a part of Baltimore's policy making, as well as influencing lots of other pieces. So it's important to understand that not every Latino in Baltimore is newly arrived, okay? And I'm referencing immigrants as newly arrived, because when you say immigrant, what pops into your head? Undocumented. And that's not the case in many cases. Yes, some are and some aren't. So I'm not going to get into that discussion today, because that's not the purpose. So when I'm talking about newly arrived is how I portray it. So those are the sort of three categories, if you will, of Latinos. But I also want to say that we have people from all over the place. We have Mexican, we have Dominican Republic, we have Central and South America. So when you talk about the Latino population, you're talking about people from all over the place as well. So we're very, very diverse. It's hard to put us in one little basket. So let me just say that, so I'm going to talk about a couple of difficulties that each of those groups have had in Baltimore. And I want to start first from my experience with the Baltimore Hispanic Chamber. So there are several businesses who have tried to become certified as a small business to be able to do business with the city. And the way that process works is you have to, check the box that says that you're a minority, and I qualified because I'm a woman and a minority. But there are several of my colleagues who had to go through several other hoops to prove that they were a minority, because the city has said, well, we've got to prove that you're from another country. But what if you've been here your whole family's been here for 20 and 30 years, or even more, 100 years? How do you prove that you're from another country? I mean, I had a colleague who couldn't get certified because of that, which is just ridiculous. So we've actually worked with the city to make some changes. They're just about to come out with a report on a better small minority business development strategy, and we've added some changes there in that regard, but also that they need to have, because there are people who are newly arrived who are very, very entrepreneurial, who want to start businesses, who already have started businesses, frankly, and want to be part of the system. So there are recommendations in there about making sure that there are language access, et cetera. Our chamber has always said that we want people to learn English, because I think it's important, but in the meantime, making sure that all people have the opportunities no matter what language they speak is also very important. So obviously language barriers are big barriers when you're talking about health disparities, when you're talking about equality and opportunities. And so we're obviously the city has to be, and the state has to be aware of that. And I think other counties are actually better at that than Baltimore is, Montgomery County, Prince George's in particular. Another thing that I wanted to point out is that, people who are newly arrived, there's such a vitriol against Latinos in particular, and I don't understand it. I'm not going to pretend to understand it. But when we hear about immigration reform around the U.S., it's really the bad parts that people talk about badly against, immigration reform really reflect on our people are talking about Latinos, and I'm not quite sure why, other than we look different, but then so do people who are immigrating here from Africa and people who are immigrating here from Europe, and so I don't understand it, and I don't I don't pretend to understand it, and I just want to put that question out there. Maybe somebody can explain it to me. The last thing I want to bring up, and I might get myself in trouble here, is that I had an experience when I was running for city council, and I think this just proves about how all of us, especially those of us on the panel and all of you, need to work together. You know, when I was running for city council, I was in a district that hardly had any Latinos in it. And so there were actually several prominent politicians who said to their constituents, don't vote for her. This is a black seat, not a Latino seat. Really? So what I bring that up to say that what we really need to do is work together, because we're all working on several of the same issues in terms of bringing opportunities and equality to all of us, and we don't need this division. We just don't need it. And I hope that in my running, I was able to change some minds about what Latinos are in Baltimore, because I did have to do a lot of explaining. I had to explain my position on immigration several times. And I'm not going to do that here because we don't have enough time, but the point is that I really hope that we can get over these barriers, because I think we can work together. I do have some hope because we all work together on the DREAM Act. You know, lots of African Americans were really, really supportive, and lots of leadership, and I was so, so thankful, because now we can give opportunities to our kids who came here because their parents came here and need the same opportunity. So I'm very, very pleased that happened, and I'm looking forward to working more with all of you and with the African Americans and Asians and whoever else to be able to break down all of these barriers. Thank you.
All right, good afternoon. I don't have a PowerPoint. I don't have a presentation for you. I have a message. And I have a message not just as the Director of Research and Public Policy from Leaders of a Beautiful Struggle, not just as a high school teacher at Connections Leadership Academy, but also, and let me just acknowledge my students. I have 20 students here from Connections. If y'all stand up, give them a round of applause. But also, as a young black man who grew up in Baltimore City, who has experienced a lot of the things that many of us are researching, that many of us are trying to come up with solutions to the problems that I feel like I face very directly in this city. I want to start with defining racism. I think many of us, we talk about racism without a clear working definition of what it is. And my definition is grounded in Neely Fuller's definition, and I'm paraphrasing here, but racism, which she equates to white supremacy, right? So these two terms are connected. Racism and white supremacy is the social, political, and economic domination of European and European Americans over non-white peoples of the world, right? That definition is very important. It is not important just for academic reasons. It is important because the way that we read history, many of us look at it and we say, the problem, for instance, during the civil rights movement, during segregation and Jim Crow, was that whites were mean to black people, and if they stopped being mean, then there would be, equal opportunities. That if whites would embrace black people and treat them good, that we would have the kind of opportunities that would allow us to have a sustainable quality of life. The reason why this definition is important is because it frames the way that we understand the problem. The problem is that black people in this society and other peoples of color don't have the same control and power to determine the destinies of their own communities, right? So if you look at the major institutions that control our quality of life, that many of those are not people whose it's in their own material interest to look out for the interest of the race that they represent, the race that they are. I want to give a couple examples. We've been swamped with data throughout the entire day. I'll give a few just little tidbits that I think are important in putting in context the rest of what I'm going to say. State of Maryland, at one point, so this is back in 2003, a study that was done in the state of Maryland, 29% of the population in Maryland is black. 90% of those who are incarcerated for nonviolent drug offenses are black. The data bears out that there is no major disparity in drug activity, right, between racial groups. In fact, the only place, and Michelle Alexander also notes this in her book, the only place where there is a disparity in drug activity is amongst youth, where white youth are slightly more likely to be using and dealing drugs, which is interesting looking at those who are incarcerated for those same offenses. If we look at I-95, about 18% of those who are driving on I-95 at any given day are people of color. And yet 80% of those who are pulled over are people of color. And this is what's even more interesting, is that whites, when they're pulled over, are more likely to have drugs in their vehicle than people of color, right? So this isn't Davon Love making this up. This is data that helps us understand what I mean when I use the definition of racism and white supremacy and talking about economic, political, and social subordination. We're talking about systems of power and who has control over the levels of power to determine the things that go on in our lives. Now, I think for many people, those of us who interact with people who come from environments that are most directly affected by these issues, we see these issues all the time. There's a deep psychological component to this that I think is very important. And that is that there's a notion that when we talk about the importance of building black institutions, see, there's a fear, right, a latent fear of even the discussion of building up black institutions, black-owned, controlled, and run institutions. There's a fear of that, okay? And oftentimes what happens in these conversations, people say things, well, why does it have to be black? You know, which is interesting because you have other institutions that represent other interests, right? So we have Jewish institutions that protect their welfare, right? Just recently in Baltimore, and as was mentioned earlier, there was a big fight about having to close down some liquor stores in order to meet the new ordinance that's going to go through the city government. And yet the Korean, there was a Korean organization, right? Because many of the liquor store owners in Baltimore are Korean. They organized together to try to challenge this piece of legislation. You didn't hear people say, well, why does it have to be Korean? Okay? So this is an issue that we face because a part of what happens is that many of the institutions that are responsible for helping to improve the quality of life of black people in Baltimore and around the country, many of them are not owned and controlled by black people. And a lot of people wouldn't even think that that's a problem. So the question that I want to pose to the audience is, drum roll, I guess, right? How important is it that organizations and institutions that serve black people are operated and controlled by black people? Let's see what we say. Okay. So I think, and I'm glad to see that a lot of people see that it's very important. I think one of the things that has to begin to happen, thank you. One of the things that has to begin to happen is that we have to shift the way that we talk about race, racism, and inequality. There's a severe lack of what I call race literacy amongst the general public in the United States. Many people aren't equipped with the conceptual and analytical tools to even talk about race, right? If you were to ask people what racism is, it's funny. Racism is one of those things that a lot of people have opinions about, but many of the people that speak with authority about these issues of race, right, many of them don't have the language to explain it in a way that matches up with the data and the way that the data bears out. So there are just a couple of solutions. So like I said, we've talked about the problem all day. I just want to give a couple of what I see as the solutions to many of the issues that we all know exist. The first is that, so my organization wrote a piece on our website a few months back talking about this notion of the nonprofit industrial complex. Right? So along with the prison industrial complex, which is an industry that benefits from the mass incarceration of black people, there's also an industry that profiteers off the miseries of our people, right? And it's very important that we're clear about that. Because what happens is, and see, here's the thing. There are people that mean well that are oftentimes in the way of genuine empowerment of those who are suffering many of the health inequities that we talk about. It's important to empower institutions, particularly black institutions that work in a predominantly black city and predominantly black communities that are most affected by things like mass incarceration, people who are of and from the community, to be in the driver's seat and who is it that is serving the community and proposing solutions for the community, right? So that's when he said we need to finance those people that are engaged in that work but aren't involved in the formal networks that nonprofits are a part of that receive the kinds of fundings to do much of the work that we see. The other is this. So like many of us know, talks about race and racism can be very uncomfortable. One of the things that doesn't get talked about enough is the notion of white allyship, okay? So it's important that when we talk about what are people's roles in the struggle for social justice and dealing with these health inequities, right? One of the questions that we need to talk about, what is the role of whites in a struggle that most directly affects the livelihoods of people of color and black people in particular? And it's important to defer to those people who are in the communities, who have been doing the work, who are among the people that are being serviced. And I think it's really important for us when we look at the notion of public health. One of the things that correlates most directly to positive health outcomes is how much power and control that community has over their lives. Those that have power and control over the institutions in their communities have better health outcomes because they know what will give them a better quality of life. And so one of the biggest ways that we can contribute to addressing these health inequalities is giving people control over their own lives. Last thing I'll say is that I think that it's oftentimes really difficult for us to connect the talking and the action. And I think one of the reasons why that's difficult is because people kind of work in their silos. People are, separated, not by choice. We're not talking about people, maliciously avoiding, being around certain people, while that certainly may be the case sometimes. But I think one of the things that's most important when we talk about institution building and helping those who are struggling to develop institutions that don't have those resources to really bolster their programs, I think what's most important is that those who are most directly affected be at the center of the conversation for how we design what the solutions are. I think many times we talk about the people we're attempting to serve and not talking with the people that we're attempting to serve. So hopefully in whatever work you do, that you make the center of your practice talking to and authentically engaging the people that are most directly affected by these issues. Because if that's not happening, then I think you have to question the motives and the integrity of the institutional program that is proclaiming to do work on behalf of the issues that we've talked about. Thank you.
Okay, my job is to keep us on task and on time. And so we really want to have an opportunity to make sure that we take questions from the audience, but I'm going to pose one question before we go to audience questions to the panel and ask them each, or whoever chooses, to take about a minute to answer this question. The topic, again, reframing for this panel discussion is race, racism, and the social deterrents of health, overcoming Baltimore's legacy. So the question I asked, and this question was actually given to me as I asked Mindy for a question, which I think is really appropriate at this stage, is who is affected in Baltimore by structural racism?
Oh, wow.
Well, I would say all of us are affected in some way, shape, or form. I think it's a question of how certain people are affected. So, for instance, there are certain people that receive benefit, right, as a result of the system of racism and white supremacy in Baltimore. There are those who are more likely to have access to quality education, those who are more likely to have access to health care, those who are less likely to be abused by the police. And I think that part is important as well. I think a lot of times we study the people who are affected as if that's the problem. The people who are affected negatively, black people, people of color, people who are poor, they are not the problem. We are not the problem. We are the result of the problem. The problem are those who are in the way of engaging in the institutional change that would allow these inequalities to be addressed. And unfortunately, too many of us are connected to institutions that won't give us the cover to levy the criticisms of the institutions that get in the way of authentic change that would improve the health outcomes in many of the communities that we've talked about.
Lynn, do you want to jump in?
I think my answer is similar. I think from the Latino perspective, we face similar barriers that African Americans face, and probably because of the language barrier in some cases, those opportunities are definitely not there, especially because there are some times where if we had an accent, we're not, we're obviously unintelligent. So I think that we, that comes out pretty strongly. I think at each level, each class level, we do face it, which is why I brought the examples in my presentation that I did of a business owner and then some an immigrants, or newly arrived. So I think in our case in Baltimore, because we have so many newly arrived, it's very different, and so I think there's a lot of the schools that a lot of the newly arrived attend aren't as good as some others, and so there's still some work that needs to be done. So I do think that there's work on all of those levels, but particularly for the newly arrived, because again, I think Baltimore's just trying to figure it out, how to deal with them. That there's work to do on that end.
In the interest of saving time, I'll just say what Davon said. Imagine me dropping the mic.
Yeah.
It strikes me that if we, so I come from a perspective of human ecology. And the fundamental thesis of ecology is that we're all in it together. So if you divide it up by race and you pit people against each other, one of the things that happens, and this is like from a psychiatric perspective, is that it becomes impossible for us to talk to each other. And then we become locked into dysfunction. And if you think about the US Congress, we are locked into dysfunction. And we can't even talk about climate change, assault weapons, how to get out of this recession. So in that sense, it's an illusion that some are benefiting from racism. In fact, it's taking us all down.
I'm going to follow up on that response to the second question that's up on the screen, and we're going to go back to the first in a minute. But for anyone in terms of wants to take on this question, the people in this room are very diverse in terms of age, race, ethnicity, background, etc. Can you talk more about different roles for different people depending on these differences?
That's an excellent question.
I would say that it's important for people to talk from their social location and to support others that are waging struggles in the interest of other oppressed groups. And what I mean by that is, and really to extend on the point that I was making earlier, is that I think a lot of times in the interest of wanting kind of a harmonious, come together and let's all fight the same enemy, I think that's important. It's important for us to come together. I think too often, and particularly, black people, right? Not exclusively, but particularly just from my social location, oftentimes what is asked is for us for the purpose of, coming together, to put aside your own racialized, ethnic material interests. And so what happens is you get, for instance, the civil rights movement, right? Which was important for our people, but many other people benefited from the civil rights movements in ways that we did not, right? And so it doesn't mean that we have to shunt aside the concerns of others, but it's like your own household, right? You have to protect your family first, right, before you can address the interests of others. That doesn't mean you don't support your neighborhood. You don't go to neighborhood association meetings, right? And so similarly, it's important for you to speak from your own social location, and particularly for black people to talk about our own material interests as being a precondition for coalescing in other efforts so that everyone's issues are authentically addressed.
I do want to follow up on that with a concrete issue that Davon, the Leaders of Beautiful Struggle, and a number of other black youth groups were involved in. A few years ago, somebody proposed the idea of building a jail in Baltimore for youth charged as adults.
Right.
So one of the, because for time limits, I didn't really get into a really deep definition of politics, but there's a politics of identity construction, right? So the identity of a youth charged as an adult is that is a political construction. But we know that if a jail was created for that identity, it would become incredibly hard to peel that identity back, right? Because once the jail is there, you've got to do it.
Right.
So a number of people fought for it, but what I appreciated, Davon, Leaders of a Beautiful Struggle, Baltimore Algebra Project, and Baltimore Urban Debate League for, and why I knew I was in the right place when I moved to Baltimore, was because what they effectively did was they mastered political speech, and they organized to the point where that jail was peeled back. So when I see that question, I understand that question, but what I interpret Davon speaks for himself, but for me, what's really important is that the people on the bottom are given the ability to master political speech for themselves. And whatever we can do to assist that, we need to do. Not speak for them, right? This isn't 1950. This isn't 1940. Actually allow them to speak and govern themselves, or at least give them the capacity to. And then we can figure out, to the extent that I may have differences with them, we can figure it out, and sometimes they're gonna win and sometimes I'm gonna win, but it's really, really essential. Our job is to get populations who don't have the ability to speak for themselves.
I would just like to emphasize that there's a dialectic, which is that everybody needs to be included in the conversation, which is not now the case. Many people are excluded. But if we don't ultimately sit down together and figure this out, and that's not about any kind of false harmony, that's about what the dickens do we do? I live in New Jersey, so we've been through the Irene, then we had a snowstorm for Halloween, and then we had Sandy, and then we had Nemo, and trust me, we're terrified. There's no such thing as knowing what the weather is. If you don't know what the weather is, what do you know? And who's going to come to the table and discuss what do we do? And this is not about what it ultimately, yeah, we are divided by race, by class, by gender, by sexual orientation. We're divided by everything. But we really better get over that and figure out how we sit down together and figure out the weather.
I just wanted to add that I think it's important that everybody educate themselves and ask the questions, and don't be afraid to ask questions, and come and visit organizations that work with various populations, or figure out how to get yourself educated on these issues and about what's going on, so that you can be anybody can be part of the dialogue. My friend Angelo Soleta is here. He's with the Latino Providers Network, which is a network of over 60 organizations that work with the Latino population in Baltimore, in particular the newly arrived. And he's a good person to talk with. If you want to know about the newly arrived population in Baltimore, go and visit some of these organizations, and Angelo can help you with that. So I just think that it's important to just be open and ask the right questions, and that way you can be part of the dialogue.
Thank you. And unfortunately, like all great dialogues, it ends long before an opportunity. But in terms of being responsive and responsible, I would ask you to join me in thanking the panelists this afternoon.